they do the trial. How do you judge whether or not the trial is successful?
It's all the patient. People sometimes, I think, misunderstand the trial. Basically, it is an opportunity for you to experience what this therapy will be like if you have it implanted. I try to use the analogy of like you're taking a car for a test drive, right? Like if you're driving the car down the street and it's making all kinds of noises and blowing smoke and whatever, and brake, you're probably not going to buy that car, right?
Right.
So this is your test drive for your stimulator. You get to take this and keep it for a week, and you get to see if it meets your needs. The stimulators, I think, are probably the best option right now for what we have in terms of treating neuropathy, nerve pain. Trials are usually 7 days. We want to give the patient enough time to really experience it.
And how long is the procedure?
Procedure's like 15 or 20 minutes typically.
That's really fast.
Yeah.
Okay, so 15 or 20 minutes, we don't have to use full anesthesia?
No, we just give a little sedation. So there are patients who don't want sedation for it, understandably so. You know, you're not going to go all the way to sleep, but we say it's going to help you relax a little bit during the procedure. We try to keep you awake, and part of the reason we keep you awake is there's safety built into keeping you awake. Because if my needle is or my wire is somewhere that it shouldn't be in your spine, you're going to tell me when you're awake versus when you're asleep. Then you wake up and all of a sudden, well, I have this terrible pain in my leg, or I can't move my foot or whatever. So keeping you awake has an element of built-in safety there for us as well. We like to see at least 50% improvement.
So you get to try it before you buy it?
Try it before you buy it.
That's good.
I think there are patients who come back and say, yeah, my pain's 50% better, but I'm walking more, I'm sleeping better, I feel better mentally, I'm taking less medicine. So you take all those things, those are things that you can't like quantify all the time, right? So even though maybe it's 50% pain relief, like I'm so much better in all these other things. I'm not using my walker, my cane, I can walk around, clean my kitchen for the first time in a year. That's not a small thing for someone. And I think someone who's been dealing with pain, chronic pain, 50% is huge.
Obviously technology has changed. Just like the first iteration of the flip phone, and now we've got an iPhone that you can be on the internet and it's basically a full computer.
Sure.
I am sure that there has been a lot of change in spinal cord stimulation, and I feel like there is a certain amount of patients that may have participated or gotten a product earlier, and maybe they didn't get the best results, or maybe they were getting results for a while and now aren't.
Sure.
Is there something that we can do for those patients?
Yeah, absolutely. So, you know, the history of stimulators is, like you said, like a 1960s car is very different from a car today.
Oh, yeah.
You know, if you got a stimulator, let's just say 2005 or whatever, you probably felt the stimulation. So you would feel like a tingly sensation in your, wherever, your back, legs, feet, or wherever was trying to be stimulated. And that would kind of mask the painful sensations. There's a lot of maybe reasons in the past with the older systems for them not to be as desirable, or for there to be issues. Certainly, even in the past, they'd helped a lot of patients. Now the technology is where most of these, you don't feel anything anymore. Your pain is just gone. We don't want to just replace one sensation for another. We want you to be as close to normal as possible.
Well, Dr. Sloop, I appreciate your time today. If anybody out there has found this valuable, I hope that you have. If you know anybody or you yourself are suffering from neuropathy, please like the video, please share it. Thank you, Dr. Sloop. I really appreciate your time today. I think this has been very valuable.
Absolutely. Thanks for having me.